Good evening, ladies and gentlemen. Welcome to Triple N Talk Show. I am Dr. Nik Nikam, and we have a special program this evening. And before we go any further, I would like you to download our Triple N app, Triple N Media, which is an app for Android or Apple devices. And from that, you can watch these interviews live on YouTube and also on Google Plus. And also you can follow us on Facebook. While you're on YouTube, you can also watch 600 plus videos we have accenting our Indian experience here in Houston. Today we have a special guest, and he is all the way from Bangalore, India, and we are going to be talking about Ayurvedic approach to cancer patients. A fascinating topic which I'm really excited in hearing about, and my special guest is Dr. Gangadharan, and he's the director of Ramaya Indic Center for Ayurvedic and Integrative Medicine. It is in Bangalore, India, which happens to be my hometown also. Okay. Dr. Gangadharan, welcome to Triple N Talk Show. We are delighted to have you.
Thank you very much for your kind introduction.
Okay. Dr. Gangadharan, maybe you can give a little bit about your background, and then we will jump right into Ayurvedic approach to cancer patients. That will be a very fascinating subject.
I am an Ayurveda physician by practice. For last 30 years. I have been doing clinical practice in Ayurveda, apart from doing research and kind of extension activities of Ayurveda as it is practiced in the villages.
Yeah.
So, and I have completed my 7.5-year Ayurveda Acharya course from Madras University in 85. Then onwards, I have been practicing. Currently, I am developing and establishing a good center of Ayurveda and integrative medicine in Bangalore city in the premises of MSR Institute of Medical Sciences.
Oh, that's fascinating. So you've been for most part in Bangalore.
Bangalore, 13 years I have completed in Bangalore.
Okay, we're going to focus. Of course, we had Dr. KB Singh, who is an Ayurvedic specialist, on our program. We talked about all these chronic inflammatory diseases and all the things that how they approach. Today, I want to focus on cancer treatment. And, of course, here we have MD Anderson, which is world-renowned cancer center. And in fact, I was in New York. That's why we had to postpone your talk. And I happened to walk through that Sloan Kettering Cancer Institute. These are all like internationally known cancer institutions and all this. They do a great deal of research and all this, and they do help a lot of patients in terms of treating cancer patients. But nonetheless, the moment people hear about the word cancer, the whole life falls apart. Absolutely devastating to the patient, to the family, to friends, and everybody else around. And a lot of times I have seen some of my own colleagues, when they had cancer or their children had cancer, when they see that the modern medicine cannot go too far in either saving their lives or controlling their symptoms, they always look for like complementary medicine or alternative medicine. And Ayurvedic medicine has been established for centuries or decades, say thousands of years. So we would like to hear from you as, from an Ayurvedic perspective, how do you diagnose cancer and how do you manage cancer patients?
No, it is
in general.
Yes, I understand. First of all, to Ayurveda, cancer is not a single disease entity.
I see.
And Ayurveda has got different conditions which are akin to many cancer conditions. As you know, cancer is not a single disease entity. It is a kind of a syndrome to some extent, because different kinds of cancer expresses in the body and live and continue in the body in a separate fashion. The Ayurveda categorically says that every disease starts from inflammation.
I see.
Shobha is the word technically used in Ayurveda to inform us that this is the starting point of a disease.
I see.
Not only cancer, many of the chronic conditions are inflammatory basis. So Ayurveda try to understand this condition from an early stage.
I see.
So we have got Shat Kriya Kala. Shat Kriya Kala is the 6 progressive stages of disease evolution in the body, as perceived by Ayurvedic physician. So this is known as 6 stages. And the last stage is what? Bheda.
Yeah.
We call in Ayurveda is the cancerous condition.
Oh, I see.
And it is a complicated condition. And Ayurveda says that different kinds of condition. There
I
is
see.
Arbudha is cancer, Adhyarbudha is cancer,
Yeah.
Gulma is cancer, Vidridi is cancer.
I see.
These are cancer told in different kinds of cancer told in Ayurveda,
I see.
which comes under the category of very difficult to cure diseases.
I see. Yeah.
But the good side of the story is that if you are able to follow the pattern of 6 stages of evolution of the diseases as explained in Ayurveda,
Yeah.
we will be able to prevent and check the cancer progress in the body. So the problem with Ayurveda, at the same breath I want to continue is that,
Yeah.
see, we have got experiences which are anecdotal,
Yes.
which are kind of hypothetical,
That's true. Yeah.
which are kind of theoretical, which are kind of based on our experience,
Yeah.
but it has not been documented properly in a way which becomes evidence for further research.
I see.
So whatever I say I can do this, that, and everything I can do, because it is a 5,000 years of
That's true.
experience
Yes.
which I am re-demonstrating.
Yeah.
But the result will be, unless we do a very controlled kind of a study
Yes.
of these conditions. You take umpteen conditions of cancer. As I
Yes.
told you, cancer is not a single disease entity. So take, for example, the early stages of breast cancer, which
Yes.
is supposed to be less problematic as on today because our early treatment devices.
Yeah.
Can you reverse that? That's
Uh-huh.
the question one should ask. And what are the changes happening before that carcinogenic activity starts in the body?
I see.
Ayurveda can do that. The
Uh-huh.
Shrad Kriya Kala is the key
Yeah.
for Ayurveda diagnosis for any of this condition, and Shobha is the technical starting point of cancer. And Ayurveda categorically say that Vigara Nama Akushalo,
Yeah.
Na Jihriyal Kadajana, Nahi Sarva Vigaranam Namadosti Dhruvastiti. Don't shy,
Yeah.
don't worry about you don't know the name of the disease.
Yes.
Name of the disease are not at all important.
I see.
The importance is in understanding the disease pathogenesis,
Yes.
the origination of the disease, and how it is expressed in different tissue elements, and how we can cut the pathogenesis pathway. That's what I will say. That so you think about only the dosha predominance in that. So ultimately it will end up the dosha theory.
Yeah. For example, to give a very classic example is smoking and lung cancer. It has clearly been shown that smokers are at maybe 10 to 20 times higher risk of having lung cancer. So in that way, do you identify certain risk factors which could be like a precursor for cancer in Ayurvedic medicine for like certain entities? Excuse me.
No, we say that all the diseases of this nature start from Viruddha Ahara.
Yeah.
Viruddham, and is very important factor. Viruddha means just that it's not food alone. Even anything that you inhale or take out are food or something that goes to the body building, tissue building. If it is Viruddha, that can slowly cause any diseases. And cancer is one among them. So Viruddha Ashanam, we said Viruddha Ashanam is incompatible combination of food and incompatible way of taking. And Viruddham is of 6 types, not one combination only. Taking food after again, taking the wrong kind of food, taking food in the wrong time, making wrong combinations continuously. These are starting point of any diseases. So we say that this has to be prevented and stopped.
I see.
So that way, if you take, as we have seen, this correlation of smoking and cancer, or constant irritation of any kind to any part of the body cancer, these are all a condition of Adi, we said Adi Prayoga. Whereas Viruddha Prayoga, less Prayoga, and Adi Prayoga. There are 3 reasons.
I see.
And this is Adi Prayoga is of same thing, used continuously for an excess. Anything, even a good food.
That's true,
We say in Ayurveda that according to the percentage, according to the dose, according to the thing you take, even Visham can become Amrit.
That's right.
The poison can become the ambrosia. And if you take ambrosia, Amrit in larger quantity can become Visha because it can become Amrit.
Absolutely.
This is the principles of Ayurveda, I'm telling. Based on that, we have to reduce
it to each condition.
And Ayurveda definitely relates, and it tells about when to start treatment, and when you start treatment, what is the condition when no treatment will be of use. So all these things are very clearly established.
So can you name maybe a couple of agents that may be sort of predisposing a woman for higher incidence of breast cancer?
That we need further study, but
I see.
We need further study. But I can say that if the organs which are not the organs, we say that the body, human body is made of millions and millions and millions of microchannels.
Yes.
What we technically call it that the all human body, Sharira, is made of thousands and millions of channels. So anything that blocks the channel is the starting point of it.
Oh, I see. Yeah.
So in women or in other people also, if these channels are not creatively made in a pristine and functional condition, any disease can happen. If that area is weak, it can become a breast cancer. If other lung area is weak, it can become a lung cancer. If the GIT is the problem, it can. So which the disease location is depends upon the weakness of the particular part of the body. So when a disease diagnosed, we have got 2-3 components. One component is the starting point of Hedu.
Yes.
Second point is the Dushya, that is the 7 tissue elements are there.
I see.
Rasa, Asran, Mamsa, Meda, Asti, Majja, Shukra.
Yeah.
Which of the tissue are affected by that dosha, and how it is getting sanchaya.
I see.
Getting accumulated. And Pragobha is how and when all the etiological factors come together in a person. Actually, what happens now? Because of body has great capacity of correction. Body has got great capacity of eliminating. So body keep on trying it. But if you overindulge things above the capacity of the body, you get into the disease. So if you are able to correct, that's why in young age, this disease generally will not come, because body's optimum level of activity is there. When 45 years after that, the regeneration phase starts. Then all the disease starts. So why I am telling you categorically like this is that these are all this Ayurveda is a science of profound philosophy. It is not just using one medicine for one disease. Ayurveda never use one medicine for it. Many people ask me, give me one remedy for cancer. I say, I have no remedy for cancer. So breast cancer, as you asked, is the culmination of a activity which is which is detrimental for that condition over a period of time.
Ladies and gentlemen, you're listening to Triple N Talk Show. I am Dr. Nik Nikam, and my special guest is Dr. Gangadharan from Bangalore, India, and we are talking about Ayurvedic approach to cancer patients. And we would also like you to download our Triple N app for Android or Apple devices, and you can watch these interviews live streaming to both YouTube and Google. While you're on YouTube, you can also watch 600 plus videos we have accenting our Indian experience here in the Houston area. And we have been talking about cancer treatment using Ayurvedic approach. Okay, how do you diagnose a cancer in a patient from Ayurvedic perspective?
Today, unfortunately or fortunately, people come to you with a diagnosis. You don't have to diagnosis.
So it's the other way around.
Actually, patients come. And unfortunately, people come to Ayurveda as a last resort.
Oh, I see.
And they try out everything. They found that they are no more. Then they come to Ayurveda. That is most of the case.
Okay.
But if a case comes to me, as on now, if it is a thing which is externally expressed, then I can tell whether it is cancer. I don't have a test to say whether there's a meiotic change is happening, mitotic change. I have no idea.
That's right.
Ayurveda does not teach me that. But I believe there is a need for an integration of knowledge system.
I see.
I should not stick to my knowledge alone, thinking that that is complete and I don't need
that's
it.
That's
I don't use. If there is a fully approved diagnostic system, say that this is cancer because this reason, you take it as a benchmark. Then you start your diagnosis, you make yourself, how is the dosha and samorchana happen, then start treatment, see how the progress. I treat hundreds of people with liver conditions. And I take the liver enzyme profile before and after. I can see the change. Or take an ultrasound of the liver, see what is the state of hepatomegaly, what is the state of conditions. So all those things are available. Why should you compartmentalize knowledge?
Yeah.
There's
I mean,
no
when
need
it's
to
available, that's
compartmentalize.
absolutely right.
The dress I wear is modern. The glass I wear is modern. Why can't you use modern knowledge also?
Absolutely. In fact, I've been a cardiologist for almost 35 plus years, and still our modern scientific approach doesn't explain everything in the medical field. Why each individual is different, and why they respond differently to a given set of drugs, and why somebody develops cancer and somebody doesn't. We're still at a total loss as to explain how each individual behaves.
But that is the strongest point of Ayurveda.
That's why I want to emphasize.
We differentiate. We say that there are 10 variants in a human being.
Yeah.
Dushyam, Desham, Balam, Kalam, Analam, Pragudim, Vaya, Sattam, Satnyam, Tadaharam. Sukshma, Sukshmya.
Yeah.
Going deep into the meticulously to the factors of this tea.
I see.
Nirikshya, Dosha, Aushadha Niruvane.
Yeah.
Before prescribing a drug to a patient for a disease, go to the 10 factors, because these 10 factors differentiate you and me. And it is ultimate importance for that. I firmly believe modern science can learn a lot from Ayurveda if you take this concept, how we thought about the 10 factors.
I see.
And one of the factors is nothing but your pharmacogenomics.
I see, yeah.
Prakriti, we said Prakriti, the human being, at the time of the fertilization of the ovum with the sperm, when the zygote takes place, the person's Prakriti has been defined. It will never change till your end.
Yeah.
So we divide them according to Vada Prakriti, Pitta Prakriti, Kapha Prakriti, Vada Pitta Prakriti, Pitta Kapha Prakriti, Kapha Vada Prakriti, and Vada Pitta Kapha Prakriti. 7 Prakritis.
Yeah.
And this is defined at the time of Shukla Artavasthe Janmadav. Shukla Artavasthe Janmadav, that time itself.
I see.
This is what personalized medicine. I say today's pharmacogenomics is in a primitive state.
Yeah.
I can challenge, because I have seen how the science is progressing. And we say that not only pharmacogenomics is not based on the dose and the reaction, it's so many other factors. You also say that some of the diseases are Asian people are more prone.
That's right, yeah.
That's one of the very, very small aspect of personalized medicine. For example, your statins. Many people come to me.
Yeah.
Who take statin for their
cholesterol level. Yeah.
Cholesterol could have been cured and they have been happy, they are 200 below.
Levels are okay.
But they are not able to stand up. All muscle cramps. Weakness, tiredness. The one lady came, if she has to go to 10 o'clock to the college, she has to try from 6 o'clock.
Oh.
Slowly moving the body. It's unbelievable. I didn't understand first. After treating, according to my diagnosis, I treated and she is completely all right. Then I found statin is the culprit. Then I found statin do this only in Asian community, not in America.
I see, yeah.
So
so there's some genetic differences. In fact, the statins have been known to cause muscle weakness, and this has been shown to be depletion of CoQ10 enzyme in the Krebs cycle. And by taking the supplement CoQ10, it's supposed to minimize some of the muscle symptoms. That's according to allopathic medicine. And do you have some specific Ayurvedic medicines for stomach cancer or breast cancer or any other conditions?
So we have got a group of, we don't have a single remedy. I will say, for example, there are many medicines, many formulations, which can be tried in cancer in different stages.
I see, yeah.
For example, we use Bhalladaka.
Yeah.
Bhallada is a wonderful medicine. I don't want to go to details, but if you use the initial stage of cancer, it will be disastrous.
I see.
But if you use the Bhallada after correcting the channels, cleaning the micro channels of the body, when the srotas are open, then use in a dose which is amicable to that patient, like you do in chemo. Slowly increase it and end up with Rasayana. Rasayana is the rejuvenating medicine. So there is a stages of treatment. So it is not, I cannot say there is a medicine. It is absolutely idiotic to say that. There is no medicine for a disease, but there is a package.
I see.
There is a management protocol. There is a systematic approach which needs to be done
Yeah.
by understanding that science. Like I cannot say paracetamol is the cure for fever.
I know.
Paracetamol is a
Yeah.
thing helpful in one conditions of fever for a specific reason.
I see. Yeah.
It's not a cure. Like that, Ayurveda has got medicine, lifestyle, and diet.
I
These
see.
three becomes the management protocol for Ayurveda. Disease medicine alone, especially for conditions like cancer.
I see.
And it is, I should say, a state like a city like Houston, which hosts this MD Anderson kind
Yes.
of institute, should
Yeah.
look into it. And we can bring wonderful result to the betterment of the humanity.
That's yeah.
This compartmentalization should be stopped. Knowledge are
Yeah.
universal.
I agree with you.
And only by debate, cross-cultural,
Dialogues,
cross-cultural fertilization of ideas, this can emerge, and that we can give wonderful results to the people.
Why has it been difficult to do studies in Ayurvedic medicine, even though there are many Ayurvedic institutions in India, very established for centuries?
See, I'll give you a comparison. If you want to plow a land to cultivate,
Yeah.
you should have ideally a tractor to which can plow, or you should at least have a plow which
Yeah.
is single. Can you plow the land with a stick?
No.
Same way, the research in India in Ayurveda is plowing the land with a stick.
Yeah.
Doesn't happen. You have to substantial support,
Yeah.
long-term mission, long-term planning. Cancer cannot be
Yeah.
researched in 5-year time. Give a 20-year time, 10-year
Yeah.
time, and give milestone for each condition, identify. So this has not been happening.
Yeah.
One of the struggle I personally make in India is to establish a center of a IIT caliber
I see. That's right. Yeah.
in Ayurveda,
Yeah.
so that people are put into place and given a definite mandate to do
Yeah.
research. It's not happening. If
That's
you
right.
go, it's a joke.
I know.
It's a joke in the name of, it is better spend that money for something else than putting there. It's
Yeah.
a waste.
Absolutely.
So,
Ladies and gentlemen, you're listening to Triple N Talk Show. I am Dr. Nik Nikam, and my special guest is Dr. Gangadharan, and he's the head of the Indic Ayurvedic Center in Bangalore, and we are talking about Ayurvedic approach to cancer patients. While you are watching this, you can also download our app, that is NNN Media, so that you can follow us on your smartphones and tablets and watch these interviews in live stream, both on YouTube and Google Plus. And you can also watch more than 600 videos we have on YouTube accenting our Indian experience. So we are talking about cancer treatment, and my special guest is Dr. Gangadharan. Okay, we were talking about all these things, but what happens is when patients go through all this modern medicine, they get the X-ray, MRI, PET scan, all these things, they get chemotherapy, they look sicker than ever before after they get chemotherapy.
yeah.
And when life comes to the end of the road, the family is totally devastated. And unfortunately, modern medicine, it gives a lot of supportive treatment, but it is not exactly what the whole family and the patient expect. Does Ayurveda provide like alternative sources of help for the patient, for the family, and for everybody concerned?
No, see, I have got personal experience in this.
Yeah.
I think it will be a very big boon to this kind of patients and family if
Yeah.
Ayurveda plays the role of complementary medicine.
That's right. Yes.
Especially during chemotherapy is
I know.
poisoning the
It is
body, and person become like a skeleton. Loses hair, vomiting. What a pathetic condition to see. You don't like to be in that condition rather than.
I personally have a lot of these patients because I'm a cardiologist. So they need cardiac clearance for most patients going for chemotherapy. So I see a lot of these patients before and after chemotherapy. That's why I say it, it's not that the chemotherapy is not doing its work. I mean, it is doing, they can show with their CAT scans and all this, the tumor is shrinking, but the patient looks sicker than ever before.
I have got at least, one recent young lady, I don't want to take her name, she's still active and alive. She had 16 chemo cycles for her second stage breast cancer. Someone told, she came to me, don't believe. I myself don't believe. Before and after chemo, no change. She was so robust. Her hemoglobin level didn't go down. Her body weight didn't lose. She didn't get nausea. She was so happy to undergo chemo in Madras. She comes to Bangalore, takes that treatment, and she goes back for chemo. But I don't say it is a standardized. I think this is an example. So if you can do this kind of, I got a hepatocellular cancer patient. He is supposed to be dead within 3 months' time when I came. 2 years completed. We are treating. And along with whatever treatment he had. And it helps us to understand what is his stage after the if you do the protocols again. But what I am telling you that complementary treatment is one of my strong recommendation for researchers to take Ayurveda along with chemo.
That's true.
Till we have an independent Ayurvedic treatment for for cancer, it is good. But now there is something available, but it has got terrific side effect. Why don't you complement side effect? And I can vouch for its effectiveness. And
so what kind of treatments do you use to like counteract or combat some of these devastating symptoms?
We give a very good regime of diet. That's one thing I do. And some of the very good medicines which will improve the immune system and circulatory system and the general well-being. So we have got plans, plenty of plans, which process in a way, and we give to them for 30-day course, 45-day course. One of the main thing I insist them to take is pure grazing cow's ghee. Medicine prepared in that ghee. We prepare and give them. Many times people don't take ghee these days because that is high fat. It's all ghee is one of the best food you should take every day in a very limited quantity for a physically active person.
I mean, if somebody has a cancer, I wouldn't be worried about, that heart disease or anything.
No, I am telling you, even ghee we don't take. That's many of the conditions because of that. So I give a package, not one medicine, one in the morning, one in the night, one after food, and add this thing. We have got a special preparations made of, which is having nascent protein, which will absorb by the body quickly, and which will cool down. Basically, what we call is that in cancer, the body becomes ruksha. Ruksha means dry, and it will become brittle. It will become a kind of. These are the symptoms of vata. So we do everything to bring down, calm it down, cool the systems. When vata and pitta is taken care of, in the very nascent, pure form of kapha is improved in the body, the person can bear any kind of this, and it will be comfortable.
That's fascinating because I think it's very important for people to know, because we give nausea medicine and all these things, but nonetheless, these patients, they have no appetite, they're too weak, their blood counts are low, and they are just, as you said, totally washed out. And they don't feel like
eating
doing anything.
This condition helps. This is one area we should, because there's no harm doing.
That's right. I mean,
it's non-invasive. And you are not anywhere tampering your protocol. You are only adding. Why don't we do that?
So
I came to, I came to Chicago, the University of Illinois last week. I am trying to tell them, and we have got a round table with the Department of Pharmacy, and I represented MS Ramay Institute in Bangalore. And I proposed 3 areas of research. One is complementary treatment in cancer. And it's a very good area.
I think so, absolutely. Besides the diet and the herbs and all these things, do you use anything else like yoga, pranayams, and aromatherapy or other modalities?
See, no, we use yoga is actually a sister science of Ayurveda. It complements always in many conditions. But yoga is soft. It's not in a condition like cancer. We can use it is soft. It works in a gradually. It needs a kind of practice. But we cannot use panchakarma because body is so weak. We cannot do anything invasive. Body is so weak, and that itself will bring that person down. But we use deep breathing exercise, and we do a lot of counseling. Counseling is very important. We say that this is not the end of the life. There can be improvement. We call something called sattva vajaya in Ayurveda. When you treat physically with medicine, sattva vajaya means improving the faculty of mind. That we do through counseling. And also we do rasayana plays a very, very important role. Rasayana is a special category of medicine which are rejuvenate in nature, which can bring which can slow down the degenerative process, which can improve the nutrition absorption capacity of the body tissues, which can stop further degeneration of cells. This is what Rasayana does. Rasayana is a very wonderful branch of Ayurveda, one of the 8 branches of Ayurveda, which is especially used in geriatric conditions and conditions of these degenerative diseases.
That's fascinating. Any other modalities do you all use besides all the things that we have talked about?
Yeah, no, we use some of the palliative care kind. We have got a very murdu abhyanga.
Yeah.
Abhyanga is kind of a very, very, very soft massage with a special kinds of oil we do to improve the cutaneous circulation, improve the muscles condition, like improving muscle toning of the muscles, and it improves circulation, nerve conductivity.
I see.
We do 45 minutes to 1 hour prolonged kind of oil massage.
I see.
We use more than 40 different kinds of massage oils for that. That's one thing we do, which is harmless. We also give them a kind of treatment of the head massage and pouring of oil for a treatment. That will calm down them, getting sleep also. That's all external, non-invasive. Main thing is Rasayana, Dravyas, diet and lifestyle changes, and some kind of deep breathing exercises.
Do you have any treatment in terms of like preventing it from recurrence or to prolong remissions, should I say?
We can say prolonged remissions.
Yes.
That is where Rasayana. See, Rasayana, this branch itself, I don't know Rasayana make any sense to you.
Maybe you can explain to us.
Rasayana is a rejuvenative treatment.
I see, rejuvenative.
There is Kaya, Bala, Graha, Urdhanga, Shalya, Damshtra, Jara, Vrisha.
Yeah.
So these are the 8 branches of Ayurveda. The 7th branch is nothing but Rasayana.
I see.
Geriatrics treatment. Rasayana, we use things which will rejuvenate the body cells, and also it improves the immune system.
I see.
So many of the conditions of autoimmune origin of today we see so many medicines. Any medicine, any disease which you are not able to diagnose, you say it is autoimmune. That has become the fact. That can be prevented or stopped by Rasayana medicine. But all those things, important is the cleansing the channels.
I see.
We say that all the disease start from the obstruction of micro channels of the body.
I see.
And body is made of trillions and trillions of micro channels. Even intracellular space is, according to Ayurveda, it's a channel. It's a srodhas.
I mean, that's how all this electrolytes like potassium, magnesium going through in and out of mitochondria. Same thing with oxygen and carbon dioxide and all this. Of course, they are all channels of electrical communication within the
that is the starting
cellular level.
Cellular level, yes.
Yeah.
No, Ayurveda has been telling this. I am telling you, I am quoting 5,000 years old text. I am not quoting 21st century book.
Yeah.
Whatever I have quoted is all 5,000 years old. But Ayurveda says, see, when the time changes, the disease changes.
Yeah.
New forms of diseases emerges. All diseases vanishes. How right it is. And it gives a way how to handle that.
Yeah.
Changing disease, don't mind about change. You look for how the 3 doshas are playing in the body.
Yeah.
3 doshas are the functional units of the body. How it interacts with the body tissues.
Yeah.
How we can bring that dynamic equilibrium of that doshas so that your health is maintained.
That's fascinating, Dr. Gangadharan. It's been quite enlightening, and hopefully those people who are going to watch, who are especially concerned about cancer treatment and complementary treatment for cancer, would be quite delighted to know that there is something beyond just chemotherapy to at least make them feel better mentally, emotionally. So, because, as I said, cancer is the most devastating news anybody can hear.
I'm sorry, I am not giving any specific treatment for cancer, which I am not want to give, but I am giving the hope and possibilities and my experience in these conditions.
Thank you very much, Dr. Gangadharan. It's been a pleasure talking to you. And ladies and gentlemen, we'll be back next time, and have a wonderful evening.